Study conducted by the Karmanos Institute and Wayne State University has found patients who listen to music while undergoing chemotherapy experience significant benefits to their level of distress during treatment.
And to tell us all about that study, we're joined by the lead author, Dr. Felicity Harper. Thank you so much for being here this morning.
Thank you for having me.
And you know, I know it sounds so simple, right, when we talk about like the healing therapeutic benefits of music, but you really dug deep in terms of this research and this study.
Absolutely. Well, you know, I think the thing is I always say music is like the soundtrack of our lives, right? Music is everywhere. It wakes us up. It's in the car. It's when we're working out. It's, you know, it's everywhere. We hear it on social media, and you know, music is just really all around us. And it seems like it's very simple, but the most important thing about music is that it makes us feel things, right? So sometimes we listen to music to feel sad. Sometimes we listen to music to feel happy.
Yeah, it elicits emotions for sure. So is music medicine, so to speak, a relatively new concept?
I don't think it's necessarily a new concept. Maybe what we were studying was a new application of it in cancer patients. So I'm a clinical psychologist as part of the supportive care treatment team at Karmanos. And you know, part of our job is to help people manage the physical and you know, mental health aspects of treatment. And so my research really follows the same. How to help people manage their stress, how to cope with treatment. And music medicine, as part of that, is really just a tool that we use to help people manage distress and really any kind of negative emotions. And the medicine piece of it is because it's usually in a medical context, so it's patients helping them cope with their disease.
And I'm curious, what actually sparked this? What were the reasons behind the study?
Well, you know, I think previous research has shown us that you know, cancer treatment can affect people's mental and physical health, and you know, physical obviously from the treatment. But I think I was really focused on the mental health piece of that. And we know that music is all around us. We know that music has positive benefits. So the idea came about, can we apply music in this context with cancer patients, in this specific context of chemotherapy? Because, you know, that's a very stressful experience in and of itself. People go into an infusion clinic, they have chemotherapy, and they're hooked up, you know, to their medications. And so we thought, okay, well, if music has benefits, potentially it could help with this population.
So tell us then, how did you conduct the study? How did that actually take place?
Sure. So what we did is what's called a randomized clinical trial. So we randomized patients either to a music condition or a non-music condition. So that's what we call the control, is that basically they just had treatment as usual. So we recruited 750 participants from our Karmanos location in Detroit, as well as 4 other sites, Karmanos treatment sites at McLaren hospitals across the state. And we had over half of them had advanced cancer, so either stage 3 or 4 cancer. And so, as I said, what we did, we randomized them to one group or the other. The people that listened to music, they were given an iPod, and they were allowed to select from any number of genres. So was it 50s, 60s, 70s, country, classic, and Motown, which you can imagine was a big hit. So patients were allowed to listen to music for up to 60 minutes. We asked them to report on their positive and negative emotions, their distress, and then their pain. And we had them report on how long that they had listened to the music, and almost uniformly, people listened to music for the whole period of time.
Really?
Interesting. And what do you recommend, given the findings of this study now, to other cancer patients?
Sure. Well, you know, I think that what we did find then is that obviously that there were benefits of music. You know, I think the thing that's great about music is that it is readily available. It is easy for patients to use, and it's cost effective. And so what does that mean? It means that cancer care hospitals and clinics, it's very easy for people to implement. And more importantly than that, it doesn't require any additional medications. So, you know, I think in terms of where do we go from here, is what we are looking at is how caregivers who often accompany patients, are they going to benefit from music as well? So it's kind of our next phase of the research. You know, and I think in terms of, you know, what people should do, First of all is that they need to find ways to manage their stress. And so we always encourage people to take what we call their stress temperature. So, you know, you take your temperature if you're not feeling well physically. I think it's important to take your stress temperature. And part of that is sort of, I think you need to know what stresses you out, when it stresses you out, and then I think you need to find outlets for that. So, you know, what for some people it's prayer, it's yoga, reading, some people it's working on cars, whatever it is that's going to help you manage the stress. And I think that's the most critical piece of that, is what can you do to feel like you have some control over your environment. So also at Carmanis, we have a number of resources. We have support therapy, we have art therapy, we do have yoga. There are also social workers and financial navigators to help people with a variety of different issues. And then I think obviously, you know, for people who think that or find that stress is getting a little bit away from them, that they can't necessarily manage it on their own through kind of any of these outlets, they can come see a clinical psychologist. And you know, what I do is work individually with patients. Sometimes I work with patients and caregivers. Sometimes I work with families. Sometimes I work with children of patients. And that really allows us to give people that individual help that they need.
I just want to circle back to the study once more. Obviously, the music showed that it helped people deal with stress levels when going through chemotherapy and whatnot. Did it show anything else that you know, your team found from that?
Mm-hmm. So because it was in a very discrete period, what we were looking at were things that changed over a 60-minute period. So we didn't measure things, for example, like, you know, confidence or, you know, depressive symptoms. What we measured was something in a very prescriptive time frame. So that's why we focus on things like positive and negative emotions and distress. Interestingly, we did have patients report on pain, thinking that because there's a psychological component of pain, that might actually work too. And as it turned out, it didn't. People didn't experience any change in pain, which may have been because it was a short period of time. It may have been because they were undergoing something that was uncomfortable, or maybe it was, you know, painful, or maybe it was that they just, they didn't have any change. The music didn't touch that, but the music touched and had an impact on all those other things.
Yeah, a variety of factors.
Yeah.
All right, fascinating study. Thank you so much for being here with us this morning. We appreciate it.